Hello, my name is Hannah Gibson, and I am a clinical psychology doctoral student at Spalding University. This presentation is about the use of EMDR as a tool for treating trauma in the primary care setting. In this presentation, I will address why EMDR should be provided in the primary care setting, why the behavioral health consultant or BHC is the best person to administer EMDR, and the strengths and weaknesses of EMDR being provided in the primary care setting. EMDR, or eye movement desensitization and reprocessing, is conducted in 8 phases. During desensitization, the 4th phase, bilateral stimulus is used in either visual, auditory, or tactile formats in conjunction with focused attention on the topic that is being targeted, such as a traumatic memory or a feared situation. The goal is to process the memory, change the way it is stored in the brain, and thus change the emotions, thoughts, and behaviors that are associated with the traumatic event. EMDR has also been found to be helpful in the treatment of other disorders outside of PTSD, such as addictions, mood disorders, and functional neurological disorders. The presence of mental health conditions has been linked to greater instances of physical illness, and they often occur together. The same applies to individuals who have experienced traumatic events. They have higher rates of many illnesses, such as diabetes and cancer. EMDR in the primary care setting is not a completely new concept. It is still a very underused practice, however, and few studies have been completed on the incorporation of EMDR into primary care. The studies that have been completed show great promise. A 2023 study explored the use of EMDR provided online to primary care patients. Those that participated had high rates of attendance and completion. The results were positive, especially in terms of improvements in depression and anxiety levels. Overall, the participants were glad to have participated and found it to have strong benefit to their lives. This study also illustrates the accessibility of EMDR. It can easily be executed in either an in-person setting or via telehealth, meaning that more patients can be reached. In general, the primary care setting is an ideal place in which to address mental health issues. Mental health issues are prevalent and can manifest in physical ways in addition to impacting physical health. As a result, the primary care provider may be the first line of contact for someone who is encountering mental health issues. Due to limited resources, individuals may also not have time or financial means to seek out mental health services, such as therapy or psychiatry. Having access to mental health services in the primary care setting, with both the primary care provider and with the use of a BHC, may be the only way certain individuals are able to access mental health care. If EMDR is offered in the primary care setting, more individuals are likely to receive care for trauma and many other diagnoses that could be impacting their well-being. The role of the behavioral health consultant is to work with the primary care providers and the healthcare team to provide care for the patients. Some advantages of the BHC role include that they can educate practitioners on signs of PTSD so that the practitioner may be able to spot it in the primary care setting and identify questions to ask the patient, or so that they can refer to a BHC or therapist. A 2009 study found that general care practitioners tend to underestimate the prevalence rates of PTSD in their patients. Because of their training, BHCs are also especially equipped to personally assess for signs and symptoms of PTSD, and with the proper training, they can provide EMDR in just a few sessions to treat uncomplicated trauma. Some limitations of the BHC role include that training is required to provide EMDR, so not all BHCs will be qualified. Short-term EMDR is best for uncomplicated trauma, so not all patients may be eligible for EMDR treatment. And the BHC's ability to help can be limited by practitioner willingness and limited knowledge about the patients that may be needed to help intervene. For future directions, there should be active discussions about providers' comfort level in assessing for PTSD at primary care visits. Building relationships with BHCs in an integrated health setting can help with assessment for and treatment of PTSD and other mental health issues. More studies are needed to explore the utility of EMDR in primary healthcare settings. There are greater ease of access to training in EMDR, including lower cost and potentially less time commitment, would be useful for allowing greater access to EMDR in the primary care setting and otherwise. And it is also pertinent that PHCs recognize the limitations of EMDR and still refer clients out to appropriate services if their presentation is not appropriate for EMDR. If interested in references, please email me at the email address below. Thank you.